delighted to be here on behalf of central government to receive and hand over the beds that the Honorable Lillian Aber lobbied from government. For us as central government, this is again a demonstration of our commitment to improving health services across our health facilities. The Honorable Lillian Aber approached, lobbied, talked to us, talked to government, showed the need that Kitgum district has, presented the need that Kitgum district has. And indeed, we did our part. 30 beds and 30 mattresses. That will go a long way to easing the bed needs in the facilities. 30 mattresses will go a long way to easing the pressure of beds and mattresses. My prayer, Mr. Chairman, is that this particularly goes to help mothers who have either delivered, who by some reason are in hospitals. It goes to helping children who are in our facilities, who for some reason are admitted. Because this is where I see a critical need. To the user department, I urge you and I beseech you to use these beds very well. Distribute it equitably, particularly giving priority to those facilities that do not have anything, whose capacity is still low. Give these beds to those facilities. And please tell the patients who come, this material is very good, but if not handled well, it can also tear. Let us not see mothers or children using razor blades to destroy these mattresses. Chairman, I now take the singular honor on behalf of central government to hand over 30 beds and 30 mattresses that were given by Ministry of Health through lobbying from the Honorable Member of Parliament representing women for Kitgum District, Honorable Lillian Aber. Thank you.
Thank you so much.
Thank you.
This is very indicative of the fact as to why, the reason as to why we elected our MPs to go and represent us. We sent our MPs so that they become our mouth. On the ground there, they must be our ears. And also there, they must be our eyes. This is indicative that Honorable Lillian Aber has done our role as an ambassador. To have gone to the ministry and picked these items here so that we are able now to receive and send down to the user department. We are happy because if it was not for an effort of lobbying, life is all about lobbying. If the effort of lobbying was lacking, those things would remain there. Like many other MPs who probably don't do their roles and are, at the end of the day, not able to access services for their people. We want to thank the office of MP, Honorable Lillian Aber, in your presence, the structure, and send back our appreciation to her. We want to receive this thing in good faith for the service of the people whom we represent. What has been presented to us here this morning are of value, and that requires that we need to take extra care to keep them safely and appropriately. These items, when used well, can have very productive results, especially to our delivering mothers. And these mattresses, the way you have seen, they're covered up by That means they cannot get easily destroyed because no liquid by ordinary sand that can penetrate down up to the foam. So this is the condition in which we want to keep the items in. And I therefore want to urge the user department through the Secretary of Health, who is here with us, to use these items appropriately, so that at the end of the day they yield fruits as intended by the Ministry of Health.
Apart from Lillian, no one could have made this thing to reach here. We coordinated with her, and then she went and put more weight to lobby for this thing to reach Kitgum. And this is the kind of leaders we need. We still need more activities to be done in Kitgum. In the line of recruitment, even if we wrote to the ministry, sometimes we don't receive the feedback. So we request those leaders at the levels of MP, if we consult them in their office, they should always move with us. That is what Lillian always is doing, and we have to appreciate this. As Kitgum District Local Government Health Department, we shall distribute this one as it is required. We have identified Muchuni Health Center.
Malaka wang Honorable Lillian, mera pu matek. Makuni ka bidok. Mera twal pochi ni wo borre. Imwa mukate enu kelewa choka. Apa ma in komo birti kan bene. Ma teokan malach. Mada malakit gini nin peoti me. Bien politana matika ni no wigiti no choka pe lo tuo mira wot ke megi choka pe. Ti ma kata go kelo choka ma watika tikere. Mira po benetam. Ma yano katikere dak ni mira tiel ko community ma chwala en Dr. Makamege. Kikitana mi buru. Mira po matek. En mi neno ni ikonyo wake kitana pa ki mattresses pa ana foye to twal di dokamala bien maternity wati kitana dek ento kay ber ka neno ne pole mi na chel mogo wanywalo nwal kanti me mogo rio adek chen lok ni ka rio adek bien dak ka onywal miro ko beto ni na chele or yano peke duoko katino nywala dek diko nywala dek tian lok ni no gitia biche tian lok ni jomo kene miro bot ko bot ping ti ma enene mi no mich enene no chero ukonyo mine ne tane no konyo mege magibino kanywal
miro wa po mego piti ma enotiu pian in ka tero wa pero mi jemi weng ma mette ente nano ken mai ramu poko kere mangene en mo konyo wakani en konyo ber kabir mo kene chiwa mer wa fo en toile pi yele mo mege wan ma chal wak mo chwini one ne kan tika don ne ni tije ma pol ma mette ken manana in charge wajo walego no ni ka twere mego miro kon toile me lobbying wa kon non block me OPD yen one oten ni kerbet ki yob gine mo pe konyo Dr. bene wormot eto gir ma jan lotela gi tiklu worgi no institution ti ma pol ma gira mu lobby ka o lobby kal body UNICEF ngongo gira mu no chembe ti gi bine yibo block en mono kwany ma wanu mero kere tien
initiative ma mego katekere na ron any kel ketana pa ki jomo twini me konyo joma ki be admitting gine wa pya kan me no services pagamente wan wa jolo ki chingwa pa machala community me mu twini for the trial mego peo cha hotim ni cha kitma on pom me el management wa jukere wan obin wan de ngoba choka makonyo umu wikitana eno tamo ne choka can is not enough to decide mekelo kitana wa mattress ye man wan mo twini lero for the trial wa jolo initiative kinero ma mego tekere ken lokeni nia ka em ki mchwini owa chwala machalo Kitgum district coverity ka konyo Uganda or a nation at large
jemne waya biru foj do ka kan fud bera ana chele da atwa ko foj bot Lillian tiche ma en tika tiyo o biru tij ma yot en to tika tope me dago karma biru rom angi support ma en biru ka mayone kuram we ko tien kare ko me wo foj matitiri ko jola en anati midwife nyo doctor mi cholo department wa titan.
I've witnessed the handing over the Muchini Health Center 3. Really, we are grateful for this. Yene karmo ber ka nywa ko tam ki dek ter wono ne there was a gap. Will kita na matien no. Pero mo tiya ko jeng weng mo mier jo ken mai kirgi emergency ko ngi mi kar go beri. Je mo ken priority ko ngi kabur mer betie. Ma mera dwak poch for honorable era MP women ki gameta me Uganda. Menen ne Muchini facilities marama adek ki supporting Kitgum. That is Okidi, Ponalabe and Muchini with 30 beds. Kitana in Kirana la diet in church. They are equipped with the drip stand. Let us take care of them. It is very important for them to remain. You don't get a chill appear attack. Let us up inventory. So that when you are handing over to the next person, he will know and will take over from there. Those records, where Chow can kita jo wai tiang ko jamu chuino pie la buje la ko pie. But I'm happy this one. Wakan pe pie la buje. Let's take care of them.
We have identified a corner labe.
Ngara fan foi madir. Pitote attack. Pa woman MP mamewa. Ne ko nya facility mamewa enemy. Yene kam karangé. En be biolo kan ko mi ore kwesi bora. O foi be en kam karangé o konyo wa kam ko win mata. Me kelo je ma konyo lwa. Me gwake i kontu corona. Yo che lo bana tinda ko kere kitana mo do foi mata bora twan. Nung da na ti bot wan mo ti kere kan ene. Kiti kere mo be. Pues que nena no sorte nunca bortie. O perga lekke perga bate o yiro district ka malaj. Ma from time and again no te kwaja ni a o no ko borge na mo kwaro kilo kan no ko ko no kilo kan. Pa wa tin tan le dan kele wa ni wa yom. Wa no ko en ini ti ju a chen mo be ma la ter me ko ke gwak no.
Bot wa matal wan staff mo wat yu kan yu wa yom. Pigin ma mego team. Piene kano pe eno par ki la goro no ko no kit gin makit man tare tana in ane tana in don konyo wan min metro welu tu ma ba big game go mal eno tu ka bur ping mio pero ma pol we wa che ko net kan ti ngom la tu pero buru ye kambe yiwa yom dok ko bor be ni wan ko ko won ke dwa kit me win won ko mo wala pere ni kar ma dir ma le pi bien ni no wan wati ngele king ma ya bet ki twin mata ne wan la goro tim wati nge an ya yom to wa ku mete ki tiche
La Gor El Center 3 kit machalo uno nano kare ko biti uno yada watika lakin buru palu tuo ka gen go bino chicken machalo tindo wan wa wale ni may go tiu dik mata yene ene tik can teach ma nyuro manufacture ma mege ma an biu chef ene an ke share bilwani lo me yot kom chi un ka dore unu chwalen motin mata nene ma kone kine wan furi umete ki penyo kon kit machalo war go wai kon timapol no mer wan o pen pian la gor kan wan wa gam tu madong ken machalo no report ka wa beri ka cha kan management no mewa tu timapol mu ya ben timanai ma ke kelo makara lok melo teach ko beti o pe ki midway yene bi ki ko wa chidum put piao bino o tino tika struggling minno kwene mo met non ki ye you want ban wa lewni effort minno midway mero don pe wan ke kana ye nan wa ye gen ma chal te nyim bene o konwa
infatti wa yo ma chala ko meno jemi mabego tino kero kitana pa machalo sub county petini wana tiki chena maramo wili ti market eni pol kara wa kero bene plan era no kid minno chena na wa no o wil kitini pere kai neno lutuo lu pole kan burino ero ki kitana pa ni angini pole pore bu cha bor pere iwi kitana na eni gin mabe ma mego neno ni gin makero ala ko kadana igi development wa betie New York comtie ka yor comtie na chere health center no jimi ma miete pere down down be ru ja tamme kenana la de way down mal ka gang ke no be bien mal kan ke dana ka porpe ko ya be no ma ke ra chere bu nyo pa chere na mal si man di ma be wan wa foyo.
We have identified Okidi
in chat material dor be mi area kanya KDL Center 3 kibino mo bene o foyo matek koñ ma no mia pe kitana ene nyo koñ megiwa kilo tia mano ge nyala fo giti ayu bne ma choka tu ci ko setting je won beriye mano nyal lung beri ma be mano ti be ti ma ko ge yot ma giti yo ma ka mano len an fo ma tek agene wano ti ki je mano mi ene yo ma be be me nyoli me area kanyene
meka kanduak me Okiri Central Village Okiri Paris the Bamida West amira chwal ki yom twin force madit gora be Lillian pikeliwa kitanda ma we ko ni lutu wa don ka bi boringo gibi no ka bor kama be ka cheki gen ge kitana kidon kwat be tikatum man inini ki luone dans logo yan kala bon ga makiti inini kombete ka dano da ngwana beach dano bure ngom manoti yan lokani ka burupe ti don pe yot kompa dano pe rak droite ka dano bion ka tuo da en bure ngom ti kata don abere di an to te ki kerne me keli wakitana pane ana twar foj ma dira de pe luak me amira yulo foj ma ta.
Because of the reason why we wrote these things, we have the structure but the bedding is not there. That is why we decided to distribute it to those particular health units. Others will be in the progress and we shall work hand in hand with Honorable Lillian Aber to ensure that we receive more and more for our people. So with this, I have to give all these things to District Health Officer as we will take initiative to distribute it as you have designed. Thank you. Use it for the betterment of our community.
Thank you so much. The District Health Officer, I'm very, very delighted for this particular day. As we are all aware, Kitgum District has been operating with a lot of collaboration. And this collaboration has been with the political wing, the leadership from the central government, the technical officers, and above all, this collaboration has provided an enabling environment which has made our work as technocrats very, very easy. I would like to thank the different leadership for providing this opportunity and also sustaining that environment to make us work and as well deliver services to the last persons. As we are all aware, according to the decentralization program, services are supposed to be at the level of the community. And this collaboration has fostered that. And as a district, for the health of our people, these beds are going to the last miles, are going to the last facilities. 3 facilities are going to receive these beds. And still I want to remind ourselves that the district local government took an effort to construct wards in 3 of these facilities. Muchwini Health Center 3, there was a construction ward that got completed by the district. Akuna Labe, there was also a similar construction that took place. Right now as I speak, there is a construction of a general ward in Okidi Health Center 3, for which we are confident that is going to get finished before June. So this has provided an opportunity for our community to use this facility in these newly constructed wards. So I would like to thank the leadership for working together with us in making sure that we tap these resources from the center down to the last mile of service delivery. In a special way, I would like to thank Honorable Lillian Aber for working very closely with the health department. As we all remember, during Women's Day celebration, she gave the district 5,000 pieces of cannulas and 5,000 pieces of giving set. That has saved a lot of lives with our vulnerable people. Not only that, drugs and supplies for Kitgum district has been very, very consistent. And this has been because of the different leaders working together. Many times people say that Kitgum make a lot of noise, but this is not for just the purpose of noise. Many times the district chairperson talks about it, the RDC, the DSO, the sector health, plus our MPs. There are regions in the country that received their consignment for medicine in last October. But for Kitgum district, we have been receiving this very, very consistent.
Including now it's being delivered.
Even now we are going to the general hospital to receive our supplies for the general hospital. And for the lower facilities, it's going to follow suit. This do not happen just by accident. It happens as a result of a lot of lobbying, a lot of consistent, a lot of having good relationship with other stakeholders. So I implore all the leaders, let's continue with this kind of collaboration, because at the end of the day, it is for the good of our people. There are other things that we have been discussing with the Honorable MP Aber that we believe is going to work. For example, the customization of the human resource structure in the general hospital is something that she is working on, and we believe is going to work, because now our population is far much beyond the structure that was initially initiated for the district. So I would like to thank her with her entire team for the work well done. We duly appreciate this, and we shall continue to partner together to make sure that our people receive the service that they deserve. As these beddings, the mattresses and the beds are going to the facilities, because Akona Labe will receive 10, Muchwini will also receive 10, and Okidi will also receive 10. We are going to talk to our in-charges to make sure that these mattresses and beds are put to proper use. These are patient beds, they are not attendant beds. And that means that it is the patients who are supposed to utilize this facility patiently. We shall not allow people to be sitting on these beds, maybe 3 or 4, 5 people. That will destroy these beds. We shall not allow people to use any sharps on these beds. We shall make sure that we sustain these gains that has already been presented as a district. So in a nutshell, I'm very, very grateful for all our leaders who are here at the different capacities. This has been all our effort. I request that we continue holding hands together so that our people have a changed health status. Thank you very much. Some Odi at least. Odi. 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 Pepsi.